that's helping reduce chronic snoring. Have a look.
I have snoring issues. Was diagnosed with mild sleep apnea about a year ago, very mild.
A month or so ago, I operated on Evan and did a septoplasty and turbinate procedure, which reduced his snoring 50 to 60%. But what we're going to try to do is to get the snoring from the 50 to 60% reduction down to a much more acceptable level to you and your wife. We're going to put these 3 pillar implants into the soft palate. So we're going to get started now. We're going to inject a little local anesthetic into your soft palate. A little pinch. So what we're going to do is put the first pillar implant in. And you really won't feel this. You'll feel a little pressure. Perfect. That's one done. That wasn't bad, was it?
No, not yet.
And the first one's usually the tougher one because it's in the midline. Second one is done. It's a breeze, isn't it? Last one. Perfect. Perfect.
That was quick.
All done.
And all the way from New York City is Dr. David Volpi, an ENT as well as snoring specialist. And we also have on the phone his patient, Evan. So, Evan, thanks for being here, as well as Dr. Volpi. We're really glad to have you.
My pleasure.
I'm especially glad
know.
to have him because this is my former resident.
Really?
I taught you everything you know, right, David?
We did.
The results. When does he see the final results on this?
Well, we did this procedure on Evan about a week or so ago, but he really won't see the true results for about 6 to 8 weeks.
Because part of that is the scarring, the fibrosis that occurs around those. They're sort of like little shirt stays, aren't they? That they add support or battens to a sail. Scar forms around that and just adds to the result.
Who's a good candidate for this procedure?
Well, first of all, there's many types of candidates, but a good candidate for this procedure is someone like Evan who has mild sleep apnea, or no sleep apnea. Someone that doesn't have large tonsils, someone that has a long, floppy, soft palate, and someone without a large base of tongue. Those patients typically do really well with this pillar implant procedure.
And exactly what are the pillars doing?
Well, the pillars are made of Dacron, and what happens is these little implants form a small bridge of scar tissue between the 3 implants, which decreases the vibration of the soft palate and gets rid of the snoring.
And Dr. Orton, I have one right here. And how long do they last, typically?
They stay in your body forever.
So, Evan, it's only been just over a week. How are you feeling?
I feel fine. You know, maybe the day after I had a mild sore throat. Other than that, I wouldn't even known I had the procedure done.
And as far as nighttime sleep, a little less vibration going on back there?
Well, according to my wife, the snoring's diminished a little bit. But I think I've gotten better sleep since this has happened last week.
That's important.
And it's only going to get better, so this is great. Evan, thanks so much for joining us. Dr. Volpi, thanks for coming to join us in New York City. And now a new mom with some questions about